Assalamu alaikum. I am Dr. Abdul Aziz, oncologist. Today I will share with you some basic ways how to interpret CBC for the diagnosis of various types of anemia. Just from the CBC and including the peripheral blood film, we can have a fairly very good idea about the diagnosis of a particular type of anemia. The only thing left, we need some more lab to confirm that our suspicion, but most of the time it is very clear from the proper interpretation of a simple CBC with peripheral blood film. Because I have seen most of our beginners, they feel difficulty in interpreting the CBC data for a very common disease where we, in our whether hospital or private practice, we encounter maybe every second, third patient with anemia. So we are, as you all know, CBC is the basic investigation, of course for anemia, but for almost all medical problems. So when you encounter a patient with anemia and the CBC report is in front of you, so as usual we will look for WBC and its differential. If WBC is in the normal range and the differential what I mean, neutrophil, lymphocyte, monocyte, basophil, eosinophil, if they are in the normal range, you can move forward. The next step is the hemoglobin. So the hemoglobin, of course we are talking today of anemias. So hemoglobin, usually it will be, if it is more than 10, nobody cares, but if it is less than 10, then we need to know what is the type of anemia and then what is its cause. So if the hemoglobin is low, the next step is you look at the MCV. If MCV is low, your hemoglobin is low, then the next step is you look for the Rbc Mass. So Rbc Mass is usually varies from lab to lab, but usually between 4.5 to 5.4 in this range. And then of course you will look for the platelet. They are supposed to be either normal or slightly high in anemia, because as a reactive process, usually platelets are slightly on higher side in most of the patients who are having simply anemia only. So as you know, anemia may be because of the iron deficiency or B12 deficiency, or sometimes dimorphic anemia as a combination of deficiency of both B12 as well as B12 or folic acid or iron. So when your hemoglobin is low and your MCV is low, you look for the reti count. The reti count is usually reflect the bone marrow activity. Suppose somebody is having hemoglobin 7 or 8, we expect that his reti count will be high. Maybe normally reti count is around 1.5%. Maybe it is 2.5 or even 3% or even more than this, because the reti count, it just reflect that the bone marrow is reacting to the severity of the anemia, and it is usually indicated by the presence of nucleated RBCs in the blood, usually in the peripheral blood film. So if your hemoglobin is low, MCV is low, and reti count is high, this is most of the time iron deficiency anemia. Then you look for the cause of iron deficiency, maybe bleeding, maybe nutritional, or maybe something other medications or this thing. Then to confirm, another data in the CBC is the RDW. If it is simple anemia because of the iron deficiency, the RDW will be high. RDW simply, it indicates the different sizes of the RBCs. So it is expected in iron deficiency anemia that there will be, because bone marrow is reacting, so the various sizes of the RBCs will be seen in the blood. It usually indicates the iron deficiency anemia. The other type is what we call macrocytic anemia. Microcytic anemia, the another is, in addition to iron deficiency, there may be hemoglobinopathies. Like we have thalassemias. But if thalassemia is out, then most of the time it is iron deficiency. The next step is, if the hemoglobin is low and the MCV is high, then you know MCV is usually between 85 to 95. So it is, if it is more than 95, it again indicates either B12 or folic acid deficiency. But again, if MCV is in the normal range, then what we call dimorphic anemia means it is the anemia is because of the iron deficiency also, as well as B12 and folic acid deficiency. Then the anemia will have, usually MCV will be in the normal range and the reticount will be high. The reticount, basic thing, if reticount is high, that means bone marrow is normal and is functioning to the decreased level of hemoglobin. If bone marrow is not functioning, reticount will be low, then the problem will be with the bone marrow itself. But we are discussing mainly the anemia, mainly iron deficiency anemia and B12 deficiency anemia, or any anemia because of based on CBC interpretation. The another anemia is which can be very low hemoglobin with very high MCV. In addition to macrocytic anemia, it can be hemolytic anemia. So hemolytic anemia, usually they present with severe anemia and with macrocytosis. Again, the reticount will be very high in them. So from the history and from this, you have an idea whether this is hemolysis or it's not hemolysis, or it is nutritional or iron deficiency, and a rough idea we can have simply from the CBC. And of course from the peripheral blood film is extremely important, because it will at least rule out any significant abnormality like leukemia or something like that. If peripheral blood film, it shows the normal morphology of all the WBC series and the RBC also, then we from all these findings we can safely diagnose that the most likely your patient is having iron deficiency or B12 deficiency or dimorphic anemia, or the only possibility is hemolytic anemia. Or there may be, as you know, normocytic normochromic anemia may be related to the chronic diseases like renal failure or connective tissue diseases, or such things may be associated with it, with normochromic normocytic anemia. Now, how to confirm these three types of anemia? This is the CBC interpretation along with the peripheral blood film. Of course, for iron deficiency anemia, we need to do the iron profile, including serum ferritin. Usually the iron profile, iron will be low and serum ferritin will be low. From this, if it is there, you can simply and confidently diagnose this is iron deficiency anemia, and you treat the cause of anemia and anemia will be corrected. If serum ferritin is normal, then you look for B12 and folic acid, especially if MCV is normal or on higher side, and if they are low, then your diagnosis will be confirmed of B12 or folic acid or dimorphic anemia. And then if they are not the case, then for hemolytic anemia we need to look for the LFT. As you know, for hemolytic anemia, the bilirubin will be high depending upon the severity of the hemolysis leading to anemia, and usually it is reflected by raised unconjugated bilirubin, and serum haptoglobin will be very low, and similarly LDH will be on higher side. So these are the things which can differentiate hemolytic anemia from other usual types of anemia. And in addition to these findings, in hemolytic anemia we can have high serum LDH and depending upon the cause of our hemolysis. If it is an immune hemolytic anemia, then we need to confirm this immune hemolysis by Coombs test, whether it is direct or indirect. So if patient is anemia, MCV is very high, retic count is high, especially unconjugated bilirubin is very high depending upon the severity of the anemia, and Coombs test is positive, this confirms the diagnosis of hemolytic anemia. So these are the simple CBC evaluation for various types of anemia, and then for the confirmation you need to do like serum ferritin and serum iron profile for confirming iron deficiency, and B12 and folic acid for confirming B12 and folic acid deficiency. And for hemolytic anemia, you need to see LFT, indirect bilirubin will be very high, LDH will be high, and the immune part is confirmed by presence of Coombs test, which is usually positive in hemolytic anemias. So I hope this is very simple interpretation and the diagnosis of various types of anemia based on CBC. We will look for, of course, WBC, their differential if it is normal. Next, hemoglobin. If hemoglobin is low, we look for MCV. If MCV is low, most likely this is iron deficiency or maybe dimorphic. If MCV is very high, then it is either B12 or folic acid deficiency or immune hemolysis, or if MCV is normal, then it may be dimorphic anemia, and then retic count will indicate whether there is any anemia is not related to the bone marrow abnormality, because retic count indicate, high retic count indicate that the bone marrow is reacting to that to your anemia. So these are the simple parameters. I hope it will be helpful in interpreting and diagnosing your various types of anemia simply from CBC. Assalamu alaikum wa rahmatullahi wa barakatuh.